теми. Громадські активісти вимагають провести публічну співбесіду із майбутнім міністром охорони здоров'я. Громадськість вимагає прозорої інформації від майбутніх міністрів про хід виконання реформ, про їхні плани, і ми з вами, як народ, маємо право це знати. Зараз на цю тему ми будемо спілкуватися із експертами та громадськими активістами Максимом Латсибою, експертом РПР з парламентського лобіювання, Дмитром Шерембеєм, головою благодійного фонду «Пацієнти України», Віктором Тараном, експертом Центру політичних студій та аналітики, Андрієм Марусовим, головою правління Transparency International Ukraine, Оленою Маtsybokh, головою правління Крона, Веронікою Вельч та Сергієм Дмитрієвим із всеукраїнської мережі людей, які живуть із ВІЛ-СНІД. І зараз я запрошую першого до слова Максима Латсибу, експерта реанімаційного пакету реформ з парламентського лобіювання. Прошу.
Доброго дня. Уряд має стати мотором реформ, а міністр – це є лідером реформи. Міністр охорони здоров'я – це друга за важливістю посада.
Position after Minister of Defense. That's because of the conditions in Ukraine, because the health minister is responsible for lives of hundreds, thousands of people in Ukraine. And the efforts of politicians and political parties to decide on them, to agree on a Minister of Healthcare was not successful. Unfortunately, the Ministry of Healthcare has a virus infected with the virus of incompetence and corruption. That's why we, civic activists, we demand a public process, open process of selection of a Minister of Healthcare, understanding how important that person, that position is for Ukraine. We are against the quota principle of building the government, and especially of the Minister of Healthcare. We suggest politicians, we offer our assistance to politicians. Civic activists call all people who are ready to head the Ministry of Healthcare to send the application to the Civic Committee, which consists of representatives of different civic organizations. Send information about yourself, your background, and your plan of reforms of your party. So we invite politicians from all 5 political groups and factions that in the parliament to send 5 candidates for the Minister of Healthcare. All civic organizations can do that, and that expert committee is ready to test every candidate and have all the plans of reforms. We are sure that that information will help Ukrainian politicians and the majority in the parliament to elect, to choose a minister who will be a leader of reforms in healthcare. Thank you. Dmytro Sherembey, patients of Ukraine. Thank you very much for coming to this briefing and to new initiative. And this is, in our opinion, it can change the history, the flow of history in healthcare. What do we want? First of all, first time during independence, the system to elect, to choose a Minister of Healthcare should be changed. We have more than 19 ministers and acting ministers who held that position. So as a result, we have destroyed healthcare system because of one reason, because they were appointed in offices because of some motivations. So our life should not be decided outside of our participation. We want the first time in Ukraine Minister of Healthcare to be elected openly, according in a competition, civilized competition. Every candidate who would like to become a Minister of Healthcare, if he wants to become a minister, not someone who will come to rob people and the state, that they can send their resume, the vision, how the healthcare system will develop, to present the team, a team before he is appointed to a minister, for everyone to have a clear idea with what this person is coming to healthcare. And how is he going to change our life? Because we live or die because of their work. It's not just work. It should give simple results. People must live. We would like to set up a committee where two political forces or just private individuals who would like to become a minister. So we sent to all political parties a letter. And the first one went to Arsenij Yatsenyuk. We call them to send the candidates openly if they are interested in to communicate with the professional civic sector, for them to show those initiatives, how they see that position, to run. To manage the Ministry of Health and the Civic Activists will express their opinion. Corruption will test back to corruption, ethics, and professionalism. So that person should come to us, to professional groups, and they should tell us what they are going to do, and we'll have them later. And there will be another category of candidates who don't want to show their background, who don't want to make their professional level public, whether they are ready to manage or not. People are elected for that position because of political attractiveness. Hundreds of thousands of Ukrainians die. It's a very dear price we pay. We should stop that culture. We should never have this practice. We hope this committee will become a precedent of a new approach in Ukraine and of new principles, how to develop a cabinet of ministers in a dialogue with the civic sector. Thank you very much, Andriy Marusov, Transparency International. Good morning. Corruption is killing. When we speak about corruption and its different features in healthcare, that expression, corruption is killing, is direct, is applied, quite tangible, because people die because some crooks in politics and from business, they decide who will live and who will die, and what will be the price for life for many people. That's why we've decided that one of the main and the most important criteria to assess candidates for the minister will be whether he was that candidate, he or she, whether he participated in corruption scandals. Is there that corruption background? And does he have it? Is he related to business? What kind of business? That's why we call all, and including business and citizens and civic organizations and journalists, to tell us when it's clear who will be a candidate and to come to us, to our committee, and bring information and even unofficially how candidates, how they are, what they did in healthcare system. Is there a corruption component there? Whether they are connected to pharmaceutical business or not, because we are confident that the corruption in this sector is reason number one, that in 20 years have passed and we don't have an efficient system of healthcare. Thank you very much. And Viktor Taran. Good morning. What is the key problem and why have we united because we want a competent and honest Minister of Healthcare to be appointed. Violation, abuses with procurement happens everywhere, but if they steal somewhere, if they rob when they fix a road, we don't feel that. But if they rob in construction, we don't feel that. But when they rob in healthcare system, that means they rob from concrete life of people. So in healthcare is responsible for procurement of medicine for 700,000 people, and these people depend on this how good that happens, on decent practice, and this is a big number. Our organization, we were monitoring procurement of the previous government, and we found some abuses, and even a temporary commission was set up at the profile committee in the parliament. As a result, so they sent a case to the general prosecutor, and they started those cases, and we hope that the situation would change this year. Unfortunately, that has not happened, and there are three factors that they prove. Then which proves that there is corruption in their work. First of all, the procurement was postponed, and those that happened, they took place in September, and the prices and patients' organizations we saw without out in the end of the tender, so we were not able even to appeal that. As investigation showed, the 40% that was a corruption margin under Bogotaryova. This year it was about 40-50% added this time. So they explained that because of the interest rate has grown for September and December and August. There was not such interest rate. So probably somebody else would like to earn here, to make business here. The second thing, they started to appeal to anti-monopoly committee, and they were blocking procedures, and that's why some procurements are blocked. All these facts, they have an excuse because of the war, and that's why we're against the quota principle. The most awful is that patients started to die, and children that don't receive some preparation for somebody's making millions and somebody's losing children. That's why against the quota principle of appointing ministers and deputies. And also we call police to check, to examine all the procurements. And in case they find the same facts like they should bring them to responsibility in the court, criminal responsibility, and they should. The NGOs should control not only appointment but also procurements. That's our requirement for the position of this minister.
Good afternoon. We always put up the criteria to the nominees, to the members of parliament. We put down the criteria last year, and now we have 5 criteria to new ministers and their deputies. These people are to be professional, integral, accountable to Ukrainian society, transparent, and be from the new generation. We are against the quota principle of forming the government. We are for the new approach when you can discuss with the public, especially the candidate for the position of the Minister of Health, and also the law on lustration should be implemented. We have been lobbying that the law has been passed, and we want it to be implemented when the minister is appointed. Olena Matsybokh from Krona fund. I am from a charity fund, and I represent the volunteers who help in medical sector. They help patients and people who are sick. Now the volunteers have taken all the functions of the state. They are providing the medicines, even purchase of equipment and capital repairs. This situation is not admissible when people have to additionally pay millions, maybe hundreds of millions hryvnias to help Ukrainians so that Ukrainians do not die. And we want this situation to stop. We want to have non-corrupt and honest minister who will be taking care of the patients, but will not be creating corruptive schemes. We would like to see the transparent process of appointment. And if in the end the professional will be selected who's not related to pharmaceutical sector and to corruption, then all our volunteers and charity funds will provide the support to this newly appointed minister. Sergei Dmitriev from the network of people living with AIDS. We have more than 100,000 people who are AIDS patients, and more than 60,000 of them have to purchase medicines. And every year, every month, we ask the Ministry of Public Health, why don't you have the tenders for procurement of medicines and for diagnostics, equipment for diagnostics? Some ministers give us answers and some not, but we are all the time at the risk that the HIV-infected people will start to die, and only the Minister of Public Health can stop that trend. Our desire is, it's like a person comes to the hospital and looking at the list of doctors, selects the doctor for himself or herself, and we also would like to participate in decision-making, in selecting people who are candidates for the position of the Minister of Public Health. We've learned that the activists sent letters to all political parties which are now in the new parliament with the request to provide their candidates to new position of the minister. I see Denis Silantiev, the new member of parliament, and we would like to hear about what is the proposal of your faction. Good afternoon. I'm here because I am for the ministers being appointed and all key positions appointed not according to the quota principle. We have so many people in the parliament, we have so many positions in the ministry, and we will appoint some people. No, I am for the situation when people who are holding such key positions so that they are professionals. And I believe you will agree that from a person who heads the ministry or the municipal administration or a school, a lot depends. I do a lot of social projects and I go to many schools. When I go to school and when I see how many sports clubs, scientific clubs, art clubs are there, and when the director says that we have the plans for this and that, then I am happy. And when I go to the school which is nearby and I listen to the director who says everything's so bad, it all collapses, we don't know where to take money from, well, that's the indicator of, and the schools are in the same district, they are just next to each other, and that's the indicator of how professional the person is. And according to that principle, we can judge about what people are to be appointed to certain positions. The person should know the problem from inside and from the outside. The person should know what the sector needs and how this could be addressed. He should be a crisis manager on the one hand, but on the other hand, a good professional. If the person heads the medical sector, he should know all the strengths and weaknesses of what will be proposed. Today's press briefing is the example of how you should treat these appointments in all the ministries. Our party is for appointing people depending on what the person has achieved in their life, and according to the principle whether people trust this person, so that the person who is trusted only such person can be holding some key position. Denis, I have a question. You came to the parliament as the candidate from the radical party of Lishko. Your party participates in forming coalition and in discussing the candidates to the positions of future ministers. Do you know which candidates your party will be suggesting? We don't have specific people. We don't have names yet. We have some people who could be heading certain ministries, but we cannot tell you the names. Thank you. Now, questions if you have. And I would like to invite all the experts here.
Чи є в нас запитання, колеги? Є в нас запитання.
Олександра Тіторова, надзвичайні новини.
I would like to hear whether you have some candidate, some specific person, because the requirements from the public, they are quite strong. This person should have some foreign diploma, shouldn't have any experience or contacts with pharmaceutical companies. Our organization is motivating different experts so that they submit their candidates, because we have been holding the position that some other people should be managing the country, and we didn't want to be there. Now the time is when people from the civil society should try at least to take responsibility and try to change the country. And our program is to maximum disseminate information so that everyone who has internal courage, expert experience and knowledge to submit their themselves. How many candidates do you have? We have 5. In a week we'll tell that, because we are now conducting negotiations. But what is important is not names, but the principles and the program of the candidate. That's more important. What will be the mechanism of selection? You receive 100 CVs, people who studied in foreign universities. This will be professional government. In our case, this is the system when the best candidate is selected, looking at the number of points they got, and we have basically, we believe that this list will be expanded. There will be more experts. We will take all the CVs, and those 3-5 who will be selected by the committee will put them for public discussion so that they can prove not just to this team but to the public that they can cope with that. The acting Minister of Public Health, because Mr. Musi is still the minister, even though he doesn't sign the orders. He was elected by Maidan. He's not involved in corruption scandals and schemes. He doesn't have his business, but he did not manage to work in this ministry, in the government, in the ministry that is all corrupt. And the minister was here. He said that he had some disagreement with the head of the government. The system pushed him out. Where's the guarantee that a new person who comes, young person, progressive, that this system, this machine will not push out that person? If these people are professionals, those who have been working in civil society for dozens of years, if they understand that they are electing a person who will change the system, then these people will provide support, and then this person should present the document and the program, and this person will come with the team, will be elected by the committee, and other people will support him. We have big experience of fighting for changes in the country, and this experience was successful. One of the problems of the acting minister was the conflict with the deputy, who was appointed according to quota principle. And when the tender procurement was stopped, well, they were saying, you are guilty, you are guilty. But that is, we believe that the minister has to select the deputies. It's not like this one will be from the radical party, this one will be from the Samopomich, and so on. So the team should be there. It's strange to hear that he could not find understanding with one or another. I do not understand how the Prime Minister communicates to the Minister of Public Health, but I understand that the previous Minister, Bogatyryova, started the process of procurements of medicines for AIDS and so on. That's important because the life of millions of people depend on that. And until now, this procedure hasn't been completed. It hasn't been done. There has been no courage to make a decision. Maybe the deputy was in the way, but why do we need the minister who cannot do something that needs to be done for the citizens of your country? One comment: a good person doesn't mean a good minister. Oleg Musi is a good person. That's an example. The acting minister is a good person, but he was not ready to be holding position of the minister, to be leader of reform, and he didn't have the plan of reforms. And that is what we are initiating. We're initiating this work to help the new coalition in the parliament to select the candidates who are ready and to become ministers, the person who understands how the ministry works, who has the program of reforms and the team. That is our task, to provide advice, because we don't have the right to make another mistake and not to implement the reform of public health, because the price for that is the life of people. The doctor, infectionist, and I would like to give the following advice. Look at the indicators for 2013. Which region has the best indicators in public health? Maybe look for experts there and invite them to this commission so that they can use their experience. Because I believe that the reform that Akimova started was not very good. And Vinnytsia, I believe, has its own experience.
I wish you gave it, there was an opportunity to see which region is the most successful. In this case, we have a very simple procedure. Someone who brings the resume, they should give a document how, in which status quo of the healthcare and what should it have, how he should choose it, change it. We are skeptical because there was no fundamental idea of what kind of health care system we should have. So we are looking forward a new approach, not populistic statements. We would like to have numbers, dates, concrete numbers, and how it will change. Tatiana Tymoshenko, I represent a platform of Civic Society, Ukraine, EU. I would like to ask you a program, a candidate for the minister to present. Will it go through, will it be compared with the association agreement we signed with the EU? Do you have this component in your program? The second part of the question, will it be agreed with positions of a coalition agreement, which is now they negotiated, and they will sign that coalition agreement? How pro-European the minister will be? In any case, we have the only way for us is through EU. Synchronization services, everything should be synchronized with EU. There are some parts of documents in the coalition agreement. They don't show everything, how healthcare will be changed, but they define what should be changed in it. We expect from that candidate a document which will meet all modern civilized criteria, and because healthcare should save lives, so it should be mentioned what kind of services, what prices, what service quality. These are simple things the world applies. They should provide that data to us. at least the direction we will move to, and how long it will take to change laws to achieve that. There is nothing special. If there is a minister who would like to be a really good minister of healthcare. Are you ready that there will be some unpopular decisions for common people? Are you ready, together with the minister, with those unpopulistic unpopular decisions, to be responsible? We hope that the majority of positions, principles, the future minister will not be popular. Because of one simple reason: we don't have healthcare in Ukraine. We should not tell people that we have it. So this is the first thing. We should start to work with a scratch, and there will be solutions that will change everything, like number of people, number of hospital, procurement system, and they will damage all the corruption schemes. And we are ready to fight together for those ideas with that minister. Because in one day, because of poor quality of healthcare, 1,600 people die. We should be courageous to fight for these people, despite the inconvenience to those people who earned on it. And if these unpopular decisions will bring us to the point that we will always save more lives, we will fight, and it doesn't matter how unpopular his ideas are. Thank you very much. I envy the future minister for such a team. I would like ministers to be chosen in the future ministry according to your principles. We are looking forward for the candidate, for the new candidate for the Minister of Healthcare. Our